Knock, knock, knock. Hi there, can I come in?
Yep.
My name's Abby. I'm going to be a nurse today. We're going to do a head-to-toe assessment. Before we get started, I'm going to verify name and date of birth.
Terry Banner.
Tell me your name and date of birth. Perfect.
January
I'm gonna
1st,
verify that.
2020.
Okay, perfect. And that matches. Awesome. So I'm going to raise up the bed here. I also would have provided privacy. Done my hand hygiene. We have the bed at a 45-degree angle already, so that is good. I'm going to put on gloves. We're going to do a full vitals assessment. Also going to ask about pain. Are you in any pain today, Terry? Nope. Okay, if you were in pain, I would assess with old carts and do onset, location, duration, characteristics, alleviating, aggravated, relating factors, treatments, and severity on a pain scale. No pain, so no meds or anything before we start. I'm going to look at the head area first. We're going to look at the neck, checking jugular veins, looking at the listening to the carotid pulse here. We're going to check the neck. I'm going to assess the pupils for perla to ensure they're equal to reactive to light and accommodation. We're going to do dentition, look at oral mucosa. Everything looks good. Okay, then I'm going to assess the chest here. I am going to pull this down a little bit, looking at the skin and the areas of the chest. We're going to listen to lung sounds here. Are you experiencing any shortness of breath?
Nope.
Okay, breathe in and out for me. Perfect. Also, I'm going to listen to the apical pulse for 1 full minute, and also I'm going to listen to the 5 heart tones. 1, 2, 3, 4, 5. Okay. And then I'm going to look at the arms. I'm going to compare them bilaterally here. I'm going to look at the color, temperature, edema. We're going to look at the IV site if there was one, do a full IV assessment. We're going to compare radial pulses. We're going to have you squeeze my hands to check hand strength. Are you experiencing any numbness or tingling in your hands?
Nope.
We're going to do capillary refill. Then we are going to look at the abdomen, and we are going to assess that here. Before we touch, we're going to look, listen, then feel. So I'm looking for any abnormal areas of the skin. Are you experiencing any pain?
Nope.
Okay, we're going to listen to the bowel quadrants here. Okay, and then we're going to palpate, looking for any rigidity or pain. So we're good there, and then we are going to assess the peri area. So I'm going to do hand hygiene, put on gloves. We're going to assess, looking for any areas of skin breakdown, making sure it's clean, dry, and intact. And then we're going to additionally wash our hands again, and we are going to flip the patient over and check the buttocks area, and that looks good. We're going to spread, looking for any skin breakdown on the sacrum, also checking the sacrum for edema. Then I'm going to listen to lung sounds after I wash my hands posteriorly, breathe in and out. Perfect. So that is done. And then we are going to ask about your last bowel movement. When was that, Terry?
An hour ago.
An hour ago? Can you describe it for me?
Normal. Formed, soft.
Okay, perfect. What about your last void?
About 20 minutes ago.
20 minutes ago? Was that okay?
Yep.
Normal?
Yep.
Normal color?
Light yellow, no odor.
Perfect. So then I'm going to move on and assess the legs. I got to assess them bilaterally here. Looking for any edema. We're assessing the color, temperature, turgor. We're going to listen to the pedal pulse, or check for the pedal pulses, also the tibial pulses. We're going to assess capillary refill. Can you push against my hands? How about up towards my hands? Do you have any numbness or tingling in your feet?
Nope.
No? Okay, perfect. Can you tell me where you are today, Terry?
I'm in the hospital.
You're in the hospital? How did you get here?
I fell.
You fell. Okay, can you tell me what time it is?
2:30.
Perfect. And can you tell me if you use any assistive devices?
Nope.
No, you don't? If you did, I would ask about walker, cane, splints, anything like that. Do you need to use the bathroom today, Terry?
Nope.
No? Okay, if you did, I would assist him to the bathroom or provide a bedpan. Other than that, we are all good. I'm going to do hand hygiene, lower the bed. I'm going to ensure the call light is within reach, call don't fall, room free of clutter, and we are done.